No! Hey, what's up, guys? This is Dr. Enoch Cote, the primary care physician you can trust. And if you're anything like me, this right here is a sign that the pollen season is here and you're probably in trouble. But don't worry, I got you, because in this video, I'm going to give you a few tips to help you survive pollen season. So stay tuned. Now, you might know it as one of many different things, whether it be seasonal allergies or environmental allergies, allergic rhinitis or hay fever. But basically, these are all referring to conditions in which you're exposed to something in the environment called an allergen, and this is causing you to have some kind of a reaction that causes you to have symptoms such as runny nose, congestion in the nose, itchy or burning watery eyes, scratchy throat, and even coughing or wheezing. And a lot of different things can do it, whether it be dust in an environment or even mold. But here in Atlanta and in South in general, we have a really bad problem with pollen, which is something that's found on trees and plants and grass that circulates in the air. It gets into our nasal passages and our respiratory tract and causes us to have all these different reactions and all the symptoms that I was describing earlier. And during pollen season, which begins in the springtime and usually goes into around the fall time, it gets really bad, and it's so prevalent here that even somebody like me, who when I lived on the East Coast or when I lived in the Midwest, I didn't even really have any problems with allergies, and I actually developed them when I moved down to Atlanta. On most days during pollen season, the pollen count in Atlanta is either high or very high. The trees that give us the most problems around here are either oak trees, pine trees, or sweet gum trees. There are multiple species of grass that produce a lot of pollen in this area, and then ragweed is also a major source of pollen as well. Now, personally, I was surprised to hear that Atlanta didn't even rank in the top 10 cities in the country when it comes to pollen count. This might have something to do with the fact that we get a little bit more rain in some of those other cities that make that list, and rain is able to sweep some of the pollen out of the air and lower the pollen count a little bit. But one thing that's for sure is that the problem is getting worse overall. Climate change might be playing a factor in this. Also, you have to consider the fact that Atlanta has one of the highest areas of green space in the country. But whether you live in Atlanta, down south, or any other city in the country, I'm going to give some tips in this video that can translate to anywhere and help you survive the pollen season. Now, for starters, you definitely want to avoid heavily wooded areas, especially those with the trees and plants that produce the most pollen in your area. Now, there's no doubt that this can be kind of challenging, especially in a city like Atlanta, considering all the green space that we have here. But this might be a matter of holding off on that hiking trip or maybe delaying that camping trip for about a week or so if you know the pollen count is going to be very high. It would also help to get familiar with the highest pollen producing trees and plants in your area so you can get a feel for what they look like and do a better job of avoiding them. The next tip is just to keep the windows of your house and the windows of your car closed as often as possible. This will prevent any pollen from getting in and minimize any kind of exposure to pollen in general. On hot, dry days and on days when the pollen count is supposed to be very high, try to avoid the outdoors as much as possible. Try to do your exercise indoors as opposed to outdoors. Try to avoid yard work on those specific days, and just try to minimize your exposure to pollen overall. Some people say that the pollen count is actually highest between 5 a.m. and 10 a.m. and other sources say that it's highest at midday. But either way, on a day when the pollen count is supposed to be very high in general, it's going to be high the whole day, so it doesn't really matter, and you just have to play it accordingly. The best sources to check the pollen count are either the Weather Channel app or the website for the American Academy of Allergy, Asthma, and Immunology. Make sure you're using your air conditioner to filter out the pollen from the air, and make sure your HEPA filters have been changed recently and are clean so they're actually able to filter effectively. After you come in from outdoors after recreational activity or yard work, make sure you wash your clothes as soon as possible and avoid drying them outside on the line. When you spend time outdoors, pollen can build up on the lining of your nose, so when you get indoors, it's important to also rinse your nose out with water or use a saline spray. It's also important to shower before bedtime, and that's because throughout the course of the day, pollen can accumulate on the surface of your skin and in your hair. So at nighttime, you don't want to get back into your bed and contaminate your bedding with all that pollen and re-expose yourself overnight. Now, if for one reason or another you absolutely have to be outside, whether it be because you work outside or have an event like a family reunion or a barbecue, you might want to consider getting one of these bad boys right here. Now, I know what you're saying to yourself right now. You wouldn't want to be caught anywhere wearing one of these because you feel like they look silly. But sometimes you got to do what you got to do in order to minimize that pollen exposure. And just keep in mind that it doesn't have to be anything fancy. It can be one of those simple cloth masks. It doesn't have to be an N95, which is one of those fancy ones that do the best job of filtering out things from the air. But I definitely recommend one of these, especially for the ones that have the highest level of sensitivity to pollen. Now, even if you follow all of the tips that I just discussed, there still are going to be quite a few people that are still going to need to take some kind of medications to help deal with their symptoms and get them through the pollen season. So I'm just going to touch on that as well. Studies have shown that the most effective medications in regards to treating allergic rhinitis or seasonal allergies are nasal steroid sprays. The most common one that you probably might have heard of is either Flonase or Nasonex. With these medications, usually one spray is applied in each nostril 1 or 2 times a day. If you can get away with only using them during the allergy season and other times of the year not using them, then that would be ideal, because long-term use of those medications, because of steroids, can still have other undesirable effects on the body, and they also have the ability to increase eye pressure as well. Because not everybody is comfortable with using nasal sprays, one of the most common groups of medications that we prescribe people for allergic rhinitis or seasonal allergies is allergy pills or antihistamines. So these are your Allegras, your Claritins, Zyrtex, even Benadryl. My personal favorite is one called Xyzal, spelled Xyzal. I like this one because it's a newer one that seems to be a little bit more effective and also has less sedating effects as well. A lot of my patients claim that they might be using one of these pills for a while, and then all of a sudden, whether it be after a few months or a few years, it would stop working for them, and they develop some sort of a tolerance. And this is something that you hear a lot universally. And it's not really backed by any kind of science, but my take on it is that if you feel like that might be the case, it doesn't hurt to just go ahead and try another one and see if it works better for you. One major thing that I would like to stress is to stay away from decongestants. So these exist either in the form of nasal sprays, or decongestants are actually combined with a lot of these allergy pills that I mentioned before. So for example, you might hear of something like Claritin D or Zyrtec D. That D at the end of it actually stands for decongestant. And these are the things that I would like you to stay away from, because they have a lot of side effects to them. Even though they do an effective job in terms of clearing up your symptoms, some of the main side effects include an increase in blood pressure and heart rate. Other side effects include headache, difficulty sleeping, nervousness, and irritability. The decongestant that's most commonly used in these products is one called pseudoephedrine, but this has a high amount of abuse potential, so more recently they've actually been limiting the use of that and replacing it with other types of decongestants that aren't as effective anyway. You may have heard about some people getting these allergy shots. These are a series of injections that are given by an allergy specialist, either in monthly or weekly doses. Basically what these allergy shots are doing is that they're slowly and carefully exposing you to the allergen or the substance that you're allergic to, in order to kind of get your body used to it and decrease the response that your body has. And really, this is just a last-ditch effort for people who continue to have symptoms despite trying all the other medications that are out there. Now, if a patient is on an allergy pill and a nasal spray and still having symptoms, another medication that I might consider turning to is Singulair, especially if they have asthma. However, this is a prescription medication, so it's something that you would have to discuss with a doctor before taking it. And really, that's the case for all these medications. Even though a lot of them are available over the counter, you still want to get your symptoms evaluated, your allergies evaluated before going ahead and taking these medications. And that's because, number one, a lot of these medications can interact with other medications that you might be taking. And number two, depending on your age and whether the medical conditions you have, it might not be safe for you to take these medications. And another consideration is that allergic rhinitis or seasonal allergies can often be confused for other medical conditions, whether it be cold or flu, bronchitis, bacterial sinusitis, asthma. So it's important to make sure you get it evaluated by a doctor before just going ahead and treating yourself. So hopefully after watching this video, you can pick up on a few things that can help make your pollen season go a little bit more smoothly. If you have any questions or any comments, drop them in the link down below. And remember to subscribe to Trust PCP for other videos and other breakdowns of medical topics. Thank you for watching, and peace out.